Hi everyone, I'm Nina. I'm the Digital Communications Lead, and I'm here with Salim Haider, who's going to speak to you about his People Participation Digital Community. Salim's role is the People Participation Digital Lead, and we're here to talk about the role of the PPDC within the Trust, within East London Foundation Trust, and it's for staff to gain an understanding of our activities and what our ambitions are for the next year. So over to you, Salim.
Thank you, Nina. So as Nina mentioned, that I'm representing people participation in the digital activities that we're taking forward. So I've been in role for just over a year, and we've been really looking to work with our service users and engage with them to understand their digital needs. So we created what we call the PPDC, the People Participation Digital Community. So we meet every other month, and what we do is engage with our service users to understand whereabouts they are in the digital lives, and when it comes to the healthcare activities, then how do they feel about digital being an enabler, an access point to be able to contact the care teams and so forth. So in those early conversations, two things really struck out, and that is there are people that are struggling with digital, and there are people that are already digitally active. So they have quite two diverse areas in terms of where people are in the digital lives. And obviously there's going to be quite a significant group of people that may be somewhere in the middle. So from the discussions and dialogues, then what this diagram illustrates is the journey that we're taking around the digital community and how we're going to support our service users and how we engage with them and how we nurture them in their digital lives, and which will then develop into how they connect into their care activities. So as any gardener will tell you, that the more time that you spend in terms of nurturing the soil, then the greater the fruit that will come out of the plant. So there is a high emphasis on the culture of people participation, and we benefit as part of ELFT of having such a robust history with people participation, and that's what we are able to leverage and develop from, is inviting people to get part in the conversations. We have a reward and recognition program that's well established, so we are already quite advanced in how we are able to operate people participation. We are working towards much more of a broader culture of co-production, and this is a key part, particularly within digital, to be able to work together and in partnership in understanding what are the problems that can be considered as a digital activity, and then what does it look like as a digital product and programs develop. So that culture of co-production is something that we want to start with. And obviously from a technology perspective, ensuring the infrastructure is there, patient access to Wi-Fi and devices and tools is something that's quite key. And a couple of other areas that we do want to be able to support is enabling patients to have digital collaboration tools, and then we come onto that in a bit more detail. And I think this is quite an important one that will develop over time, and that will be evaluating the digital policy for our service users and patients. So how are we able to support them in terms of forensic activities when they are in care, and opening up digital channels that allow them to be more involved in their care activities. So this is something, if we call those the 5 pillars that we're looking to be able to support, and then that will help us grow and develop. This will be, it's not fixed in time. As we go through and engage with our service users, then there will be other things that could be coming out. But this is where we are at this moment in time, to be able to highlight what they've informed us of and where we could be driving this model to. The key thing here, I think, is that what are we aiming towards? And there is a wealth and a growing evidence base around digital empowerment does strengthen patient empowerment. And at the top of the tree, we are looking towards going digital care pathways. Our health system is developing into much more of a patient self-care model. So that is something that we do want to be able to support, is that people are confident in their digital lives and digital capabilities that allow them to better engage into the digital care pathways as they emerge. So as the tree is unfolding, we talked about the digitally excluded, and this is really realizing people who are struggling with digital access or digital skills, digital literacy. Then how can we support them to be more confident? And we've engaged with the Recovery College, and it's a fantastic opportunity where they will be recognized as a digital hub in the local community, and it allows them to be able to grow training programs where people can go to and have that personal relationship with the college to be able to develop what are the needs that they can help develop them in more of a digital lifestyle. We are also looking at improving access within our sites within ELFT. So if there are rooms that are available, that are things that are available like digital pods, and PC terminals that allow people who are not digitally activated have a safe space to come within ELFT where they can engage in video consultations. So that's an area that is developing and growing, and this has really been focusing on a work stream out of the PPDC. There is a digital excluded work stream where service users engage on a monthly basis, and we are really proud of the work that has been taking place there, and it is being driven by service users to show us what we want to be able to do. And in this whole period of co-creation, it is something that we really are benefiting from, and it's developing really well. Another area that we started on this year is around the digitally included. So this is the whole area of engaging with the service users and gaining the value of their lived experience in sharing what would work for them in a digital capability. So we are introducing a change in the framework of how we look at digital. We're working with the digital team within ELFT and updating their processes and procedures that allow and will enforce much more of a collaborative activity. So when a digital project has been considered, that project will need to go through a digital partnership group to ensure that we've had that dialogue and conversation, that we are meeting the needs of the community and the solution is going to solve the problems that the team is looking to deliver. And as the development of the life cycle as the development of the product is underway, then there's key points of engagement to ensure the design, usability, the content, the language, the deployment models, the training activities is something that will be in a collaborative spirit to make sure that everyone is aware of what we're looking to achieve and what is the best way of engaging and gaining success quicker. So these are the things that we are working towards in the digital environment. And I think that this is something that will grow and develop. And as an organization, you will be invited to support this in any digital activity, which is patient impacting. I think the key point is that anything which is developing for a patient contact, if it's an app, if it's a service, if it's data that patients are going to be impacted by, then let's get involved in that partnership model so then everyone is able to support the engagement that's going to be taking place. So there is one other key point that I do want to highlight here is as we go further up the tree, there is the aspects around digital mentorship, and that's supporting the people in the digital activities and guiding them through a training program and activities. So through the Recovery College, there is a peer tutor training program that's being developed, and we would like to emphasize that if you are working or seeing any service users that are struggling with digital, then do please guide them towards the Recovery College. They will be able to support the people in terms of the digital engagement coming up. So in the next few weeks, this peer tutor training program will be launched, and it allows us to be able to engage with our communities more effectively. And hopefully we see some of the merit of that quite soon. Another key aspect is around the people, well, we have a platform that's being deployed at the moment known as Patient Knows Best. It's in Hackney under the SPS service. And what we're piloting there is a user group which involves service users, but also clinicians, our communications teams, and Nina is part of that, our PPL team and digital team. So together we can discuss and understand how the platform is being utilized, where areas of improvement can be taking place, if there's any functional capabilities that we may need to look at as well. So we can have quite a broad discussion that allows all of the key stakeholders that are involved in that development activities and in the launch of that program to be able to take valuable feedback and see what change initiatives that can be applied to make the experience of using Patient Knows Best that much better. So Patient Knows Best as the moment is within Hackney, and it is looking to be deployed across Tower Hamlets and Newham. So it will be largely a East London platform. But for the people that are in those directorates, then please do look out for that. This is something that's going to be coming through the digital transformation activities, which I think Jamie Stopford is going to be supporting. So there's a lot that I've shared so far. What I would like to also highlight is that we will be taking part in some newsletters and roadshows. So we will be coming closer towards you as a service, just to talk about the PPDC and how things are developing, and allowing our service users to be able to present that capability. So then we are much more of a deeper engagement from our patient communities and service user groups that allow us to be able to discuss more freely about our digital activities and capabilities we're working on. So hopefully you're able to take some of that information in. It is just a door opener, and I do look forward to seeing and welcoming you all to come to the PPDC and talk about your digital services and solutions that could be coming your way, and be much more involved in a collaborative activity. So thank you for the time, and I look forward to catching up with you all soon.
Thank you very much, Salim. That was wonderful. And yes, as Salim said, please do get in touch if you'd like to collaborate on any digital projects, and keep an eye out for any more PPDC content that will be going on the website and intranet. Thank you, everyone.
Cheers.